I'd like to introduce our last paper this afternoon, Dr. Newall from Houston, Texas. Prevention of Thromboembolism in Large Volume Liposuction and Body Contouring Surgery, experience with 300 consecutive cases in 3 years.
Thank you very much, Don. It's a pleasure to be here and share my experience with you. None of the authors involved in this study have any financial interest or commercial ties with the manufacturer of the low molecular weight heparin, enoxaparin, or Lovenox. As you all know, thromboembolism is one of the most feared and serious complications in large volume liposuction body contouring. The incidence of DVT in the U.S. is 1.2%, and over half of them become PEs. 1 million patients are tested annually for the suspicion of DVT, and only 25% have a diagnosis confirmed. Our objective is to present the current protocol being used to prevent the formation of DVTs and PEs, and report the ongoing study that we're doing with the use of Lovenox. This is an ongoing study. We started in 2003. We now have 400 patients, they're all female, that we've done liposuction as well as tummy tucks and any other combination. We are presently enrolling only women to eliminate any sex-specific variables, and the majority of the patients have fallen in the categories of high risk and highest risk, as the SAA refers. Oops. Sorry. Just getting this. Sorry. Just. All the patients have undergone general endotracheal anesthesia in a fully accredited patient facility, and they'll have been discharged after 23 hours. We all know the established recommendations, and I have followed them religiously. However, still I had a 1% incidence of DVT and subsequent PE. So that prompted me to investigate this and possibly add another modality and further decrease this. The maintenance of the core temperature was very important, 36.5, heating pads in the operating table, humidify oxygen, constant change in body position during the procedure, use of positional pillows and wedges, use of upper and lower bear huggers, intermittent pneumatic compression stockings, Foley catheter for restricted fluid monitoring, and early ambulation. Our new addition is the use of Lovenox, 40 milligrams, 1 hour after surgery and every 24 hours for 3 days. Our technique is a traditional liposuction, super wet technique. We use 5 millimeter blunt cannulas for general aspiration and 3 millimeters for liposculpting. The incisions have been left open. Abdominoplasty, as described by Lockwood. We use pain pumps in all the abdominoplasties, or antibiotics and compression garments for 4 to 6 weeks. Our age range between 22 and 57 years, and our BMI between 23 and 43. The average length of surgery was 2.5 hours. The mean preoperative weight about 70 kilos, and 60% of the patients had a previous history of estrogen use. I usually tell them to stop their use 2 weeks before and 2 weeks after. 3 patients have reported some transient and non-specific complaints similar to DVT and PE, but after a comprehensive evaluation by an intensive care team of specialists, none of the patients had any diagnosis confirmed, and they experienced a very healthy recovery. Our conclusion is that no patient had experienced DVT or PE with the use of this protocol, and we feel very optimistic that with this initial 400 patients, we can further decrease the incidence of this terrible complication. There's some results here for large volume liposuction before and 3 months after. Combine large volume liposuction with an abdominoplasty, no body lift done. Similarly, large volume liposuction, abdominoplasty, and a breast augmentation. Large volume liposuction, 3 months later. Large volume liposuction, 3 months later. No tummy tuck was done in this patient. Thank you.